Nancy Ahuma has been nursing her twin boys at Gulu Regional Referral Hospital for a week now. They were supposed to be discharged on Friday, but that has not happened. Many other children who were scheduled to return home are still stuck at the hospital. The wards affected the most by the sit-down strike are the children's ward, the accident and emergency ward, the maternity ward, and the acute malnutrition unit. The interns began the strike on Friday in protest over the non-payment of their allowances, totaling to 3.2 million shillings since October last year.
It does not mean that because I'm doing internship, that is the opportunity the government has to squeeze me. And this is the basis of the demoralization that has gone on among the health community.
They say the health ministry promised to pay them by next week, but the doctors say they are not backing down.
All along they have been promising like that. Sometimes you have to take in the promise, but it is unfortunate that the strike is meant for the ministry, but the ones who are feeling the impact of the strike is the hospitals where we are touched, and the patients who are actually suffering.
The hospital offered them 500,000 shillings for their January and February allowances as they wait for the ministry to pay up. But most of the interns declined the offer. It's only their head, Dr. Dansan Atim, was accepted to continue working.
People who felt it is human enough to work on patients as they wait for the money from the ministry, take the money to help them limp as they wait for the ministry's money.
It is not clear when the issue will be resolved.
It is presumed to stay as long as it will, so long as there is no relevant communication that has been passed.
Some of the patients who have run out of patience have chosen to take matters in their own hands.
The
NTV has learned that other interns in other hospitals are also demanding for their payment. It's often people who cannot pay for private health services who suffer the brunt of such strikes. Unfortunately, this is not the last or the first time we would hear of such cases here in Uganda. Moses Sakena, NTV at Gulu Regional Referral Hospital.